But in Nigeria, it's not patient-centered. Even in hospital setting, you see either the pharmacist is briefing the doctor, or the doctor, not being real, or the doctor is briefing the pharmacist like, who do you think you are? How can you tell me the dose of this? Yeah. Hello guys, welcome back to my channel. It's your girl Yomi again, and as you can see on the channel today we have a visitor. She's pharmacist Ejeomah.
Hi.
Yes, and as you can see from the title of today's video, we're going to be talking about the differences in the pharmacy practice in Nigeria and abroad. I studied in the Philippines and she studied in Ukraine. So we're going to be talking about the differences in the practice in these countries. If you'd like to know more about this topic, if you think it's something that you are interested in, please make sure you definitely keep watching. So I have some points on my phone and I'm going to be asking a few questions and both of us are actually going to be answering. And she doesn't know about these questions, by the way. So this is typically unscripted. So we are hoping that we'll be as honest as possible. We're going to be as real as possible with you guys. And so we're going to start from the school aspect first. Yes. So let's talk about like number of years and probably like the subjects. What do we think are the major differences in like the pharmacy practice in Nigeria and then in Philippines and Ukraine? What do you think?
Okay.
Do you think we have major differences?
For me personally, I've not studied in Nigeria, so I can't tell. Like I wouldn't be able to like differentiate between like which like the differences between studying in this country and in that country, because I didn't study in Nigeria, but I will be able to relate more to the country I studied in. Okay. So the number of years. So for pharmacy in Ukraine is 5 years. That's the minimum, and you either get a master's in pharmacy or you get bachelor's.
Okay. So which one did you get?
I got the master's.
Nice. Okay.
So what about you?
Okay, so for Philippines, pharmacy is actually 4 years. It was 4 years, but I was told now it's currently 5 years because they added some subjects, and now they want to start giving out. It's now going to be doctor of pharmacy. It's going to be PharmD.
Nice.
Yeah. So I think it's not going to be 5 years. And but I think I think we have about 2 schools in Nigeria currently that are currently issuing out PharmD. I think so, just 2 schools, but every other school is just Bachelor of Science in Pharmacy or B-Pharm. We call it B-Pharm in Nigeria. So that I think that's it. For the subjects, we can't really say what's the difference because we didn't study in Nigeria, so we can't really say. But I know that they say it's usually tough and difficult and expected. It's not as if pharmacy outside Nigeria is not tough, but I think that there are some things that they tend to like major in Nigeria that is not supposed to be. You know, they make everything in Nigeria very, very, very difficult. Whereas abroad, it's more relatable. Like it's easier for you to actually study and pass in abroad.
So which one did you get? Like
it's B-Pharm, Bachelor of Science. Bachelor of Science in Pharmacy.
But 5 years for a PharmD, that's
that's what they want to start. I don't know if they've started in Philippines, but I know it's something they want to do.
Yeah, I would like to encourage everyone to go for a PharmD.
Actually, because Bachelor is like outdated.
Yes,
it's not outdated.
That's the way forward. Just go for a PharmD. That's better. But, I would like to ask like how you studied, how your curriculum were like in Philippines. Were they online, or you had to get like the lectures handed out to you by the lecturers, or how was it like? And also language barrier.
We're coming to that. Okay, we're coming to that. So actually for the lectures, we had our lectures like physically, we had to go to classes and all that. But there were times we couldn't go to class because of typhoon, natural disasters, and then so sometimes you have to probably do like an online. They'll probably send you the like the modules or whatever you have to do. They send you the file online, and so as soon as you return to school, you know that you're going to be writing exams back to back, or you're going to be writing quizzes and all that. But our classes were majorly physical. Like we didn't have to do so much on online.
Okay.
Online class, yeah.
Okay, ours was more like we always had these modules where we read like where we have like the topics for each day. Like say if you're having this class today, you have to go online and get all your materials. They are online.
Okay.
Then you come to class and then the teacher like asks the questions. Then like just. But most likely you're allowed to do all the readings yourself. Then the teacher comes to ask you questions, and then if you have questions,
similar.
yeah,
So, okay, it's similar. Yeah,
So
it's a bit similar.
alright.
So did you have any language difficulties, or were you always like what's the English? Were you always, did you feel inferior because you were a foreigner, or how was it?
Okay, I would like to ask you this question, but let me first answer. So we had like international students studying independently. We're not like with the Ukrainian students.
Oh,
yes. So, but for you,
we're together in the class. Everybody.
So
like,
were you taught
in English? We're taught in English,
Okay.
although there were times they would switch to their language.
Wow.
And then our student association, what they call it, they'll be like,
Yes.
if you have any professor that is not speaking English, just come and report them to us, blah blah blah.
Are you
Because they're like, they accepted foreign students and
Yes.
we pay our foreign fee, so they're
Yes.
obliged to like teach us
Yes.
English. So if they are not trying to do that, we should let them know so they can
Yes.
take the appropriate steps. And so they actually try to, although sometimes it's easier to communicate in their own language. So if they want to probably really explain something deeper, they switch to their language.
Wow.
And then maybe some of my classmates will be like, excuse me sir, we have a foreigner in this class. I'm like, oh okay, yeah, Miss Bayode, I'm sorry. And then they will try to say like again in like English, just to make sure everybody doesn't just to make sure that they carry everybody along. Yeah, they were that kind, and they were that. Filipinos are actually very, very. If you're a Filipino and you're watching me, shout out to you, because you guys are like the best. They were really they paid attention to us. Although there were some people that were very mean, but I think about 70 to 80% of them were of my professors. Like they try to make sure that they speak in English, and even if they don't, they try to make that somebody interprets or like that. But they had us in mind. Like they didn't like ignore or they don't care if there's a foreigner. It wasn't like that.
Okay.
They try to make sure that they pass the message across.
So like you're saying the second language like
is the major language is Tagalog, yes, but English, yes.
So all your students study in English?
Yes, apparently that was the standard, but sometimes they speak there. But what I'm saying is, as long as I am in that class, I don't know about how they do it if I'm not there, but as long as I'm in class, they have to like make sure that this.
But did they write their exams in English?
Yes, of course. It was in English.
Okay.
Even when they give out their manuals or anything,
Yes.
their handouts, everything was in English. Or even our exams were in English.
What
Although I had to take their subjects in like my first and second semester.
Okay, yes.
So just so I could understand it. I took their
Alright.
subjects for 2 semesters.
Yes.
Yeah.
But what about the Filipinos, like the students?
Yeah.
Did they take their exams in English? As
It
well?
was in English, everybody.
Oh, okay.
Even our results, everything on the wall, everything is English language.
Okay, but they had like universities for just Filipinos, right?
No, there was no
Okay.
specific university for only
Okay,
Filipinos.
alright.
It was open to everyone.
Okay, that's fine.
So how about you guys?
Yes, ours was quite different. Like we don't mix with the Ukrainians.
Wow.
No, just foreigners. Like so in each, and we are always like there's no, except maybe when we have general lectures. That's when you see like every other students, but not Ukrainians.
Wow.
So we are always grouped into 12s or like 10 or like, do you understand what I'm saying?
Yes,
So
yes.
each teacher or each lecturer to one group, and so we don't mix with the Ukrainians at all. So we just have, so we have people like from everywhere else aside Ukraine. Like maybe Egypt, Morocco, all this other places, India, all these other places. We just stay in one group. Then Ukrainians.
So was it out of racism?
No.
It was just
because of, I think, that language barrier. So Ukrainian students were taught mainly in Ukrainian language, while foreigners and international students were taught in English. Only when we had to take like the Ukrainian language. Do you understand?
Okay,
So that was just the difference. Yeah.
Nice. Okay. Okay. For the next question, what would you say about the practice, like community practice? Were you opportune to probably do like internship or to work or to even see how it works there, like the way it is now in Nigeria?
Yes. So the sad part is because of this the way we studied, we never got to really do a lot more practical because of the language barrier, like I said. So we're only like taken on tours to these places, but we never really had the time to like stay in a community.
Yeah.
Come on, you can't stay in a community practice. You can't do like, you can't work in a community like a pharmacy if you can't speak Ukrainian language, because 99% of the people you are dealing with are Ukrainians, and of course most of them can barely speak English. Like, because you deal more with like the older generation, because maybe they have like those drugs that they have to so, but you can't, if you can't get across to them, they don't see the reason why you should be there. So they like encourage you to maybe go elsewhere to do your practice, or you can just like,
so there was no internship or anything for foreigners.
They would give you like a specified month, or like to go and do to undergo your internship, but they will encourage you to like go outside. Like, so some people would go to the UK, go to like countries that are like to take their internship. But some people who were ready to learn Ukrainian language could, because if you could learn and you like understand how to speak, there was people that speak and could write. They were so fluent, so they could take jobs in like Ukraine. So that was just it.
Nice. Okay, so we can't really compare. But for me, I was in community pharmacy for like 2-3 months.
Wow.
And although there was, of course, there was a problem of language barrier, but I was able to see how they arranged their drugs and everything, and it's totally different. The difference between the community practice in Nigeria and outside, oh my god, it's so, let me just be specific. Philippines, it's the difference so wide. Like, you can't really do OTC is strictly OTC. There are some drugs like antibiotics, antihypertensive that you can't get over the counter, you need prescription from the doctor. But here in Nigeria, you can even get antiviral over the counter. I don't know. It's actually crazy. Like, they don't. That's why even in Nigeria, like, the rate at which people abuse antibiotics. I think that's it's really crazy. Like, and then in Philippines, so something I learned again, like the difference, because currently I'm in the community practices in Nigeria, and in Philippines, so let's say like a prescription comes in and there's like a prescription error, you would see that they probably in that area they have like the list of the doctors that will work, so they can actually just pay, this is from, maybe for example, this is Manila Med, this is so am I speaking with this doctor, there's like name, but in Nigeria you receive prescriptions without a doctor's name or a doctor, or there's no dates. In fact, so let me just go into that, but so many things happen in Nigeria that it's just out of it, and maybe they bring like a prescription and there's like an error. So you can't even reach out to the doctor in Nigeria, because first of all you don't even know if the name of the hospital or the prescription is valid or not valid, or even if it's valid, you can't even reach out to the doctor. But there you can actually reach out to the doctor, and then they approach the doctors politely. There's this patient-centered practice that they practice over there. But in Nigeria, it's not patient-centered. Even in hospital setting, you see either the pharmacy is briefing the doctor, or the doctor, not being real, or the doctor is briefing the pharmacy like, who do you think you are? How can you tell me the dose of this? And then even, I feel like, because I worked in an hospital, and if I see a prescription error, I go to the doctor and I'm like, okay, how about we do this like this? But some pharmacists approach the doctor and they will make them feel like you don't know, and they will tell that to the patient, like, why would the doctor? That's not. It's a medical thing. Like, it's supposed to be something internal, not you say it to the patient. But in Nigeria, everybody wants to prove I'm the baba of this. That's why some pharmacists will tell you they don't want to work in the hospital because they don't want to be subjected to a doctor. They want to work in the pharmacy, and they want to be like the boss. And then, but outside in the Philippines, everybody is working like we all have a goal.
It's a team.
It's a team. But in Nigeria,
I understand.
It's not really a teamwork. It's an egocentric kind of practice. I think that's
everybody's trying to be like, no.
Even now, some nurses will go to pharmacy. They're like, this is how I've been, and I'm like, no. And they're like, no. And then there was a case of this. Oh my god! I remember when it was the time I was in the hospital, and there was this nurse I was working. She was a bit elderly. She was the matron, and then I think they were giving the patient Petitine, and the doctor, I was the one giving her the drug. So they didn't want the patient to be dependent on the Petitine. So they were like, okay, give the patient water for injection, placebo placebo. She was like, no, it's against her religion, no. How can she be telling the patient she wants to give her petidine and she's giving her water for injection, that she cannot do it? And then the doctor was like, haven't you heard of placebo effect and all those? She said no. Before she eventually gave this thing, and then I'm like, wow.
Yeah.
Like just like a perfect example, of what the practice is in Nigeria. Like it is what it is, man.
Yeah, I noticed this with the teamwork.
The teamwork,
because like even I work in the hospital and so I can relate with the, like, sometimes when these prescriptions come, you might even feel somehow to go
so
to
you can meet the doctor,
except
just
like,
someone you run with.
What should I do? Yeah,
except person is like your a friend,
then you can be like, is there a reason why this is like this?
Maybe there's
can we do this or that? Like, so yeah, sometimes they're like, no, I know this is it. So
I know this will work.
And at the end of the day, the patient suffers because
that's what makes me go crazy. Like it's not about you, it's not about what you know, it's about how the patient currently feels. Like I think somebody walked into the pharmacy yesterday and she brought like tons of drugs. Like she was on cetirizine, she was on dihydrocodeine, she was on another antihistamine, and it was making her really drowsy. And then I'm like, yo, who gave you these drugs? Like combination of everything. Because she came, she was like, she needs to speak to a pharmacist. Like, and then I'm like, that's like an example. And then some pharmacists to actually do this, they just all they want to do is just to sell their drugs, to sell the most expensive, to move the supplements, to do this. But are you also considering it's supposed to be patient-centered first before the money or before your own perspective or anything? It's about the patient first. But I think that's something that we are really, really missing in Nigeria.
Okay, so I don't know, this is really interesting, this topic we got into, because I don't know if it's because of the current state of how the country is right now, the economy and all that. People are no longer like, I don't know, like, because if you're kind to yourself or you're kind to people, you wouldn't do some certain things. Like people do certain things that are not like things that you should talk about. You understand what I'm saying? Like some people are like just selling because they have percentage they get off. So there are things like that.
That table is shaking. That table is shaking. That's another aspect. We don't want to dive into that, but to be honest, that's something people also. Okay, so the next point I'm going to asking you now is the next question. What do you think about the equipment in like hospitals, like in Nigeria and then abroad? Like, what do you think? Are there like major differences? Maybe like the structure or how things are being arranged in the hospital or like the consultation room. Let's even limit it to just the pharmacy section. Like, what do you think do you think there are major differences or even the medical field, like generally?
Yes,
you think?
Obviously. Sometimes you walk into a hospital in Nigeria. Okay, I've been.
Let's specifically general. Yes.
Okay.
Is it general?
Not private. Like government-owned hospitals, and you're wondering like what happened to maintenance. Do you understand what I'm saying?
Thank you.
So and then things are just like, or you walk in and it's so dark. Like
the ambience
is just off. Like some people, like some patients walk in, they already have issues and all that. Then they walk into an environment where everything is just off. Do sometimes like an environment has a way of making you feel like it's not just the
a mental
a mental thing, exactly. But whereas outside the country, like you walk into the hospital and
hotel. Shout out to Manila, man. Like everything is just on point. Like it's so neat. Like, but in Nigeria, general hospital, you see the system, dust. Even the keypads, in between the keypad, you see very white, and it's just the curtains. Let me just go there.
Yes.
The maintenance in Nigeria, like you guys, except it's a private hospital. I've seen a private hospital in Nigeria where everything is just marked and everything is just set. But now you gotta have your money.
Whereas in
abroad, you don't necessarily have to have money, like to be able to access. Even government abroad, you have like the basic stuff. But in Nigeria, snake is following the money somewhere.
Even like abroad, like the times I've gone, like in Ukraine, let me use that. In Ukraine, the times I've maybe I had to go to the hospital and to do one or two things, like the expense, you can't compare it to even a government hospital here. It's a lot cheaper. Even for them, most of them get free.
Some things are actually free, yes. I think there's this post I saw online was it on Instagram, that this guy talking about, a doctor talking about the vein detector.
Yeah.
And then before you, that was and then the guy was saying that and was talking to someone about it, but was like, why do you have to do that? And even before you can find a chubby baby's vein in Nigeria, like sometimes you have to shave it, and you have to pierce, and then, oh my gosh,
leg everywhere.
Why is everything Nigeria so difficult?
It doesn't have to be hard. I think in Nigeria it's almost like it has to be hard for it to be
working. Yes,
but it doesn't have to be like that.
Like you don't have to be very. Oh my gosh.
It's so
So for the last aspect, actually, I hope you guys are enjoying this video.
Please make sure to like and subscribe.
Please. For the last aspect, we've been talking about the payment or the remuneration, salary. What do you think? Compared. I think that's incomparable. In Ukraine and Philippines. Okay.
To be honest, let me be very honest here. In Ukraine, one of the things like made me think about like staying back was the income. I think it's a lot better than Nigeria, but it's not at the place where it's supposed to be, like compared to other countries
like the UK,
yes,
US.
It's not at that, because I don't think the doctors are well paid as they should be. But one thing I love about Ukraine is they make, since it's not a I wouldn't call it a, like, you can't compare it to the UK, you can't compare Ukraine with the UK or the US, but one thing the government did for them was to provide every other thing for them. So they get every other thing almost free of charge. So it's very easy to live there, because it's low cost of living. You don't have to spend so much to live like in a place like Ukraine. So I love that about them. But in Nigeria, everything keeps getting expensive and people keep earning the same amount of money. So that's crazy. yes.
Yeah, that's But then in Philippines, so I think it's quite affordable. They make sure that at least everybody can have access. At least if you can't pay for the brand, then you get to get the generic drug, and it's something that you can afford. So would you have loved to like stay back there? Like, what were your reasons?
If I had paid attention to learning the language, I would have stayed back, and I mean, it would have been helpful in a bit, because you'll be able to live amongst Ukrainians and you get more job opportunities in a place like that. So
for Philippines, we're not allowed to write their board exam, so just for their citizens here. So as soon as you're done, just go back home, or probably go to another country so you can write your board exam, so you can practice. And thankfully, I came back home and I wrote my exams, and now I'm practicing. I actually finished 2017, and now it's 2021. And I can really tell you that the difference between these practices is really, the gap is like so wide. It's huge. So you guys, we hope you were able to. Do you have any other thing you'd like to say to our viewers?
I wanted to say that you couldn't get, like, when it comes to work permits, that was also another issue in Ukraine, right? But you could stay back using, like, studying, like, you can do like a master's in one subject or the other. Do you understand what I'm saying? You have to be studying. You have to have a study permit so that you can be able to stay in Ukraine. But I think the laws have changed now since the new president came in, and I'm not sure about that. So I wouldn't dive into something I've not like researched on. So because I came back 2019, so I don't know how things are now. So that's it. So
thank you guys so much. Thank you for watching. So she's actually a YouTuber. Please make sure you go to her channel.
Moments with Ejeomah.
Yes,
it on the box.
Please make sure you go there. Make sure you subscribe. Please show us some love. Show us some love on the channel. Please and please.
You're welcome.
Yeah, she's a very
feel free.
Yes. She's a social person. Definitely learn. You would learn anything or two from our channel. Please make sure you subscribe. I hope you're able to learn something from this video. Please make sure you give this video a thumbs up. Make sure you share with pharmacists. Share with anybody. Just share with your friends. Everybody. Thank you so much for watching. Bye.